Thanks for joining the People of Precision Health podcast, a series by Vibrant Health where we discuss the unique challenges of building human cohorts for health and clinical research. We talk with experts in population genomics and precision health to explore novel methods and real solutions for engaging the humans behind the data. Our guest today is Sofiya Milman, MD. She is the Associate Professor of Endocrinology and Geriatrics at the Albert Einstein College of Medicine, also Director of Human Longevity Studies at Einstein's Institute for Aging Research. And Dr. Milman's team conducts translational research on the discovery of genomic mechanisms that regulate endocrine and metabolic pathways that protect against common age-related diseases. Some examples: diabetes, cardiovascular disease, Alzheimer's. And they do this by focusing on a very unique population, centenarians and their families who are generally free of age-related diseases. And that is one of the reasons I'm so excited to have Sofiya here to talk with us today. It's fascinating work. Sofiya, thank you so much for joining me.
It's a pleasure to be with you.
I can't wait to dig in because, as you know, I've been following this study for quite a while, and it's one that I think really is groundbreaking in a lot of ways. So a little background. You're ambitiously aiming to build the largest cohort of centenarians for research to date. I'm interested to know, what was the catalyst for starting this research program, and why 10,000 participants?
All good questions. So research in centenarians or superager populations has been ongoing now for decades. And we have been able to learn a lot from them, but we were significantly limited by small sample sizes, meaning we really didn't have enough people or the numbers of people that we need to answer these biological questions of what allows these people to live these very long and healthy lives. And so in order to overcome this limitation of numbers, it's simply a numbers game, we realized we need to increase the number of centenarians in our studies. And that's how this idea was born of the SuperAgers study. We decided we need to think innovatively in order to get the kind of numbers that we need to make the kind of discoveries that we want to make. And so we realized we need to go nationally and use innovative tools, use the technology that now has been borne out in order to be able to achieve the goals of reaching these very large numbers of individuals and including them in our research.
I collaborate with some others in other areas of research that struggle with something similar. Rare disease is another example of a type of research or an area of research where that is critical to go nationally in order to achieve the numbers you want. But I'm interested, is there a relevance to the number 10,000?
So the more, the better. And in genetic research, the bigger the numbers, the more power you have to make the discoveries, especially in something that's rare, as you point out, in rare conditions. And exceptional longevity is among one of those rare conditions. We don't think of it as a rare disease, but it is a rare condition in the population, according to a census that was done about 10 years ago. Less than 2% of the United States population is age 95 or older. So we really are looking for a needle in the haystack. We wanted to get as many people as we could, but also being realistic within the confines of what's achievable, both in terms of reaching out and resource-wise. And so we settled on a number of 10,000 because we felt that that number would give us large enough numbers to expand the discoveries while also staying within the realities of our resources.
Right. So, speaking of resources, one of the really, I think, relevant to a lot of research programs, one of the things that is especially interesting about this study is the level of collaboration and the various entities, institutions involved. So, what does that collaboration look like at a high level? How has this team of resources come together?
Yeah, so this is definitely a collaboration between academic partners, industry leaders, and nonprofit organizations. So American Federation of Aging Research is sponsoring this study. They got a generous donation from the James Fickle Family Foundation, and that's how this study was really able to take root and become a reality. And AFAR has really been equal partners with us in helping us and make connections across different disciplines, finding partners in media who will help us spread the word about the study, which is very important, right, for doing something nationally. We have academic partners who have many years of experience in doing centenarian research, both at Einstein and at Boston University. And then we're also collaborating with Regeneron Genetics Center. They are really invested in using genetic discoveries to better human health. And they will be sequencing all of the samples that we collect. And that's from them that we're going to be getting the genetic sequences for these subjects.
Yeah. So you are focusing on an interesting group, and as you said, it's a rare condition. This idea that people live longer, but you've said something a couple of times that they're generally healthier longer. There's this name that we're using in this study, the SuperAgers Family Study. So what does it really mean? Because it's not just about living longer. What should this term really represent in terms of what a superager is? Beyond reaching a certain milestone, what is a superager from a health standpoint?
To us, a superager is someone who, as you point out, doesn't only live long, but maintains their independence and their general state of good health so that they can continue to do the things that they enjoy, right? And continue to have a good quality of life. It's really about maintaining a good quality of life as one ages. And we know that age is really the major risk factor for most diseases that we associate with older adults, right? Like heart disease and cancer, diabetes, Alzheimer's. Unfortunately, we all know of older adults who are dealing with these conditions, and it is primarily older adults, right? Very few young people, thankfully, have these diseases, and so these are really diseases of older age. And if we look at the risk associated, let's say, with heart disease from getting older versus having something like high cholesterol, right, which everyone always thinks of, oh, this is our greatest risk for heart disease. Being older actually confers a much, much greater risk for heart disease than one's cholesterol level. And so what's really remarkable about these individuals, the superagers, is that despite being of very advanced age, right, which puts them at a very high risk for all of these diseases, they remain healthy. They seem to be able to often escape from these diseases. And when they don't, they get these conditions 20 to 30 years later than the general population.
I think the term superager is really a great name for this because, as you point out, these risk factors that are commonly associated with these diseases, many of them are lifestyle related and some of them choice related, but aging is one of those things. You are going to age. No one can control that. So, but some people do it really well. And that's why I love the term superager. So I think as someone who's watching my parents age, I'm excited about the things we're going to learn. And to that point, these superagers, let's be very candid about this. I don't think there are many people out there who would look at a study focused on centenarians, regardless of how much independence they have, and say, that's a perfect population for digital methods. And so, one of the unique things for how you are engaging this population is that you're including the superagers and younger family members. So they are part of the study in a couple of different ways. But tell us about the reasoning behind involving the younger part of the cohort. The offspring are included, and the spouses of the offspring. Tell me more about why those groups are included in this program.
So I would say they're both scientific and practical reasons for doing that. The children of superagers inherit the genetic makeup of their parents. And a lot of research has shown that genetics make a major contribution to one's ability to live long and healthy life. And by studying the children of superagers, we think we can, in a way, extend this population, right, to the next generation. By studying the spouses or partners of these children of superagers allows us to compare individuals who have a familial predisposition to longevity, a genetic predisposition to longevity, to those who do not, those who don't have longevity in their families. And in every study, it's important to have a control group or a comparison group. And these partners of the children who don't have longevity in their families allow us to have a fair comparison, a group that lives in the same environment, right, because they often share the same home, the same food, the same air, but yet don't have the genetic predisposition to healthy longevity. And they really allow us to hone in on those genetic components that contribute to longevity.
That design is so it's genius in my opinion because of the things you said. It's the social determinants of health in some capacity, the environment, the lifestyle choices. It's like having there's so much less variable in the lifestyle and the way that these spouse versus superager descendant, if you will, live. It's really a genius way to design that control group. But tell me the practical reasons too, because I think that's a very important part of how you are engaging the population.
Right. And as you pointed out, we are relying on digital tools to enroll this population of 10,000 superagers. And not all superagers are comfortable with using digital tools and technology. We do have some who are, and there's one superager we met who actually teaches a Photoshop class, which is remarkable. She's over 100, and she teaches this class. But not everyone has the same comfort level. And this is where their children or even grandchildren come in, where they can help their family members navigate the technological tools and help them get engaged with the study and participate in the study and enroll in the study. So that's why they're really very valuable partners in this.
Yeah, I think it's, again, genius. But they, as different members of the family have different experiences, you're having to manage some varying participant journeys, if you will. They have to experience the study and the research a little bit differently based on who they are and what their role is. Are there any workflow kind of approaches to communicating with them, or engaging the centenarian versus the child of the centenarian versus the spouse, um, managing these different members of the research study differently that you want to share?
We approach it through different media outlets. So when we're trying to reach the younger generation, we often rely on things like social media. Whereas when we try to engage the superagers themselves, we feel that more traditional media may be more appropriate, like newspapers and television. So these are some ways in which we approach these generational differences in reaching out to our participants.
So that's a great point you're making, because a lot of, I think, research in geriatrics in particular is done face to face, is done in clinic, and then you're very limited geographically and also by resources. And using digital methods is, as you've noted, it's a little more complex with this particular type of population. So tell me a little bit about the approach you've taken to recruitment. So I know, for example, that we are not just using digital eConsent, for example, just by itself. There is a mix of methods, and digital technology is supporting even the ones that are, completely analog. But I'm interested in the approach to recruitment, what's unique about this, and what's working. And I'm also going to ask a little bit about the messaging that you're using for gaining their trust to be a part of this program. But let's start with the first, the approach to recruitment and to consenting. What does that look like for this national program?
So once an individual is engaged with a study, we have actually created an informational video where the participants can learn by watching this brief video about all the aspects of the study, what's involved, why we're doing the research that we're doing, what they can expect from the study, what will be their responsibilities, and also how we as researchers plan to use the information that we learn, and also the responsibility that we recognize we have in protecting their private data. Because in today's day and age, many people, probably for good reason, have concerns about their data and its privacy when it exists in the digital realm. And so that's one of our major responsibilities, and something we take very, very seriously, is to protect the participants' private information when it is included in our study. And so we share this informational video with them. And if after they learn about the study they want to participate, then they can go through the eConsent process where the study shares with them the consent form in a digital format, and they can even sign it digitally. So it really eliminates the need for back and forth mailing of consent forms, which we have done or are even doing for some of our other studies, and allows the process to occur much more quickly and more efficiently.
Mm-hmm. And I think something that I have spoken with a number of other collaborators and other studies that I have some involvement in, is this idea that the consent from home, eConsent, opens up the opportunity for them to bring someone that they trust in to help them and help them through that process of performing consent. It's not just about putting a computer in front of a super ager and expecting them to feel comfortable going through a process. Your involvement of their families, for example, is a key part where they can sit with their grandmother, great grandmother, or parent to help them through the process. And it feels more communal, if you will. And also that helps to build trust, I imagine.
Yeah, absolutely. I think you're bringing up a very important point, that this becomes an event where the entire family can be involved and can contribute. And I think that's really important, to be able to build that sense of trust and having those family members there to review the materials with them and maybe to support them through the process is really instrumental.
Yeah, and there's another unique part of your study, which is kind of the community building and the community aspect of what does it mean to be a super ager? And I've spoken a little bit with some of the team at AFAR about this. And can you talk a little bit about the importance of not just that building trust through the family participating together, but also creating a little bit of a digital community for super agers and their families?
Yeah, that's another aspect of the study which may be unique in some ways. I think some people may not realize that it may actually be lonely to be a super ager. Hopefully, it will give them an opportunity to meet people who've had similar experiences and connect with them. And so this is not just a social community, it's also a scientific community where information about newest research is shared with everyone who wants to understand about what science is doing to extend a healthy lifespan and what we can potentially expect in the future from the discoveries.
Yeah. And I think it's so critical. And I just thought of a funny story. I'll try to make it super brief. My great uncle, who I named my eldest son after, Uncle Graydon Maple, was a super ager. He passed away at 99 and a half, finally. He had no children. I joke that may be why he lived so well for so long. But something he used to say to me is, I don't like talking to people younger than me. I like talking to people older than me because I feel like I'll learn something from them, which, take that for what it's worth. But as a super ager, it does get lonely because you run out of people older than you. And Sofiya, one of the things you're doing is creating this network of people, of peers. And it's also really couched in this scientific, the scientific kind of wrapper where there's not just community and connection. There's also benefiting the scientific community in the future and potentially future generations. And so I'm excited about that. But in order to do that, your team has to be equipped. And I think that one of the questions I know a lot of times researchers wonder is, do digital methods like the ones you're using for data collection and for consent, those may enable us to collect more data and gather more participants into our study, but are they creating undue burden on the research staff? So can you answer, has the digital technology you've used helped your staff be more effective in performing the research and the study related tasks they need to do? If so, what would you say is the most obvious area it's improved?
Yeah, that's a great question. And I have to say, for us, using digital tools has actually had the opposite effect. It hasn't burdened us more. It has actually freed us more to do more with fewer resources. Uh, we actually don't need as many research staff um, because we don't have to engage one-on-one with each participant, right, for every step of the study. We also feel that the data collection is more accurate because no one has to transcribe the data from paper forms into a digital format or into a database. The data is already entered into the database. It also allows us then to do very quickly these data checks and quality checks to ensure that the data that's entered is accurate. Oftentimes, you don't get to that step until you've entered all the data, right? You transferred all the data from the paper forms to the digital format, and then you get to do this QC. We're able to do that almost immediately because our data is already in a digital format. And this will also allow us to, I think, share the data more quickly with other researchers, again, because it is already in a digital format.
Yeah. And how are you? I know that the data from the SuperAgers Family Study is going to be available, or perhaps it is available to investigators elsewhere. What is your approach to sharing the research study data across other institutions?
So the goal of this study and this initiative is really to create a resource, a geoscience research resource. And for those who are not familiar with the term geoscience, it is really the scientific underpinnings that drive aging and its biology. And so we want to make this available to as many investigators, both in the United States and abroad, as we can, because we feel the more scientists have access to the data and can approach this data from their unique perspectives, the faster we'll make discoveries, right, and get the answers that we're all looking for. We're all getting a little bit impatient because we're all getting older.
Right. That's the problem. Not only is the population aging, the research community is aging, everybody's aging. It's just one of those things.
Right. It's in everyone's interest to get these answers as quickly as possible. And we feel that by allowing this to become an easily accessible resource for researchers will drive that innovation and will drive the research forward. And so when the study is going to be completed, or at least partially completed, we intend to share the clinical data and the genetic data with the research community through a secure database. So the researchers would need to apply for access to this data, and they will have to agree to follow certain scientifically accepted regulations, but that's generally true anytime scientists request use of data. But we do plan to share it with both academic and industry partners. It won't be limited only to certain institutions, because we do feel, as I said before, and I can't stress it enough, that the more people are working on it, I think the quicker we'll get the answers.
Particularly, I think, because you are creating such a large data set around this population, including genetic data. I hear from a lot of industry and sponsor research teams that they are struggling to find access to genetic data that it has all of the additional phenotypes and the clinical piece, because there are those limitations. So I think that's exciting to hear, especially for this patient or participant population in particular. There are a lot of potential for therapies to be discovered, and really it's a major opportunity for sponsors in particular. So I want to talk just briefly about when we look at this study, I think there is a uniqueness because people over a certain age are typically overlooked in other more broad research programs. And so it's very unique in that way. But I'm interested in other measures of diversity, whether that's the ethnic, racial, socioeconomic, demographics, or data. Are there any things that you've done in particular, any partnerships, collaborations, or approaches you've taken to drive diversity in your participant group?
Yeah, I'm glad you're bringing it up because, as you've said in the past, many studies have not succeeded in enrolling the diversity that represents, right, our country or our world. And we feel it is really important that we do represent the full scope of diversity through this research study because we want to make sure we learn as much as we can about all the different populations. And it's possible that certain populations may have, unique genetics that allow them to live to 100 that may be different from some other populations. And so this is of major interest to us, and we are actually exploring now different ways in which we can engage people from different backgrounds. As you said, we want to make sure that we're not only focusing on the Northeastern populations, that we have a good representation of populations who live in the South and the minority groups that make up the beautiful, diverse population of our country. And so we're actually trying to tap now into different resources and to maybe even some, spokespeople who will be willing to speak on our behalf and help us reach out to those populations to make sure that they are included in the study.
Those are all great approaches. I think that one of the benefits of having a national study is that you're not limited to that geographic region of the country that may be more homogenous. And so you have the ability to draw from various methods that have worked and then focus them in on regions. So I like the way that you're thinking. So a couple last questions, because I think this study is I know you said that everyone's impatient. We're trying to find new things, learn new things, and we want to uncover some discoveries as soon as we possibly can. But I imagine you've already learned a lot about being a superager. What does that mean about the world? What drives happiness, long life? So have you personally learned anything working with these centenarians, these superagers, that you've kind of taken away either into your work or life?
Yeah, they certainly have a lot to teach us. And some of the things that have struck me is their positivity, their positive outlook on life, kind of always remaining hopeful and optimistic about the world around them, and also not resigning to things either, constantly thinking of how they can continue to improve themselves, right, or improve their society or their environment. There was one gentleman I met him when he was 99 years old. And when he was 99 years old, he was an avid swimmer. He would go swimming 2 to 3 times a week. He would bowl at least once a week. He was in great shape. He looked like he was only 75. And he told me that when he was 80 years old, he was obese and sedentary. And then he decided that he really needs to make a change in his life and lead a healthier lifestyle. And so at the age of 80, he took up all of these physical activities and started taking better care of himself. And there he was at 99, continuing to do these things. Now, I don't know if, changing his lifestyle at age 80 is what got him to 99, or maybe it was just that, can-do attitude, that it's never too late, right? That one shouldn't just resign to things, and we can all continue to grow. And so I think that's probably one of the most important lessons that I have learned, is that we can continue to grow and evolve. And frankly, that's what we should all do.
Yeah, it sounds like I feel like it's something that's easy to say, and you hear people say that, but when you are in front of a person who actually lives that, personifies that idea, that age is just a number, that has to be one of those moments you take it away and you take it to heart and you think, I really do have opportunity to improve myself. So I love that. That is inspiring me to spend more time with the SuperAgers that I know, the few of them that I know. So we always like to ask in this podcast, because it's a important question. From what you've seen, what do you think the SuperAgers Family Study is going to contribute to the science of longevity and what we know in the next, let's think first about the short term, next 3 to 5 years. What do you think you're going to learn?
Right. So in the next 3 to 5 years, I'm quite confident that the SuperAgers study will expand our understanding of the genetic architecture, if you will, of healthy aging and longevity. It will help us make additional discoveries of what are those genes and maybe biological pathways that are regulated by our genes that are contributing to healthy longevity. And once we get a better understanding of those discoveries, I think it will accelerate the development of therapeutics. Because in the past decade, we've been much more successful at developing new therapies, right, and drugs when they're based on knowledge that a certain pathway is important for human biology, for example, right? So when we often find populations who may be rare, who may carry certain rare genetic variants, who are exceptional, right? Either in cases of diseases, but also in cases of being protected from those diseases. So one example is some people carry very rare genetic variants that allow their low density lipoprotein cholesterol levels, right, or LDL cholesterol, the bad cholesterol, to be very, very low. And they're actually protected from heart disease. And so when the pharmaceutical companies were able to capitalize on that discovery and create drugs that mimicked that beneficial genetic effect, they created a very effective and relatively safe therapy to lower cholesterol in people. And so by broadening our understanding of genetics, I think we will be able to hone in on those important pathways and genes that can be translated into therapies to delay aging much faster than we were able to do up until now. Because if you're actually getting your information from humans, that information can be translated, I think, more effectively than if we first learn it in animal models and then we try to test it out in humans, because I think we've all learned over the years that the physiology of, say, rodents and humans is quite different, and things that work in mice often fail in humans. So by taking discoveries from humans to humans really has the potential to accelerate those translations.
I love that because that's you can see the demand for anti-aging therapies at the certainly the surface level. But what we don't think about is better aging, whole human, better aging. And that is, I think, so much more important. So let's think long term, next 10 years. What do you think the impact downstream the SuperAgers Family Study is going to have? Think big.
Right. So first, I hope it will really be a gateway to other, even larger studies to make even more and better discoveries. And, as the next generation of SuperAgers grows up with the technology,
Yeah,
right,
it'll be easier.
To using it. And ultimately, we want everyone in our society to become a study participant, right? And what I mean by that, we're really heading into the age of personalized medicine, when we will be going into our physician's office, right? And all of us will be getting our genetic profiles. And based on that, right, our doctor will be able to tell us, well, you need to do this, or you shouldn't do that, or, right, you don't need to worry about this. And this study is really, kind of only the tip of the iceberg, right, where we're trying to get an insight into that personalized medicine. So that I think that's kind of where we're headed, and we can hopefully think about this more broadly. And I also think it's quite realistic that we will start seeing therapies come on the market that are effective at delaying aging. And by delaying aging, what we really mean is by delaying the biology of aging, right? And the biological changes that the body undergoes as it ages, we can then delay with it all the other diseases that come with it, like heart disease and cancer, and diabetes and Alzheimer's disease, and maintain people's functional abilities, right? Prevent frailty. That's really what it's coming down to. We're not really after having everyone live to age 120, but we're really are trying to achieve a reality where, maybe people live 90, but those 90 years are healthy 90 years, where they're able to maintain their independence and continue to enjoy doing the things that they enjoy, right? Enjoy their families and their friends. And that's really the goal of our research. And again, I think it's a very realistic goal, because once we begin to understand that there's a biology that drives our aging, right? That biology is no different than the biology that drives heart disease or the biology that drives high blood pressure. And we've been able to tap into those biological discoveries, right, to control people's blood pressure and protect people from heart disease. So there's no reason why we can't do the same for aging.
Absolutely. And I cannot wait to see what discoveries come out of the study, or from others who tap into the data in the study. I see so much promise, and I'm so excited about it. So, Sofiya, thank you so much for joining the podcast, and thank you for sharing your very unique perspective and the future vision that you have. And I really encourage anybody listening to this episode to tell every SuperAger you know to join the study and to spread the word about this study. So thank you again. Thanks so much for listening to the People of Precision Health podcast. To join us next time, subscribe wherever you get your podcasts. And to learn more about how we're helping to engage the humans behind the data, visit vibranthealth.com.